March is National Colon Cancer Awareness Month, and here to help us learn the risk factors as well as the advancements in treatments are Doctors Sujith Kalmadi and Nguyen with Ironwood Cancer and Research Centers. Good morning, doctors. Great to see you. Thanks for joining us.
You too, Suzanne. Thanks for having us.
Dr. Kalmadi, let me ask you, let's start with you first. Let's talk about the risk factors and how can people reduce getting colon cancer. What can they do?
Yeah, so there are, I think, two aspects to that. One is lifestyle modification to help reduce the risk of getting it. So we do know that the major risk factors for colon cancer includes age. Majority of these cancers are over the age of 50, number one. Number two, familial. If you have a history of cancer in the family or a polyp in the family, then you're at a much higher likelihood of getting a precancerous polyp or developing cancer subsequently. Number three, if you have any genetic syndromes which put you at risk, there's a big one called Lynch syndrome, Lynch syndrome, and familial adenomatous polyposis. Those obviously put you at a very high risk of developing colon cancer, 80% to 100% sometimes. And then we know that it's definitely associated with increased incidence in the developed world as compared to the developing world. And that evidence is pretty clear because we have seen that Southeast Asians who migrate from China to the United States or to Europe have a much higher risk of getting that. African Americans tend to have a lower incidence in Africa, and yet the same African American population in New York has a much higher incidence of getting it. So we think there's a connection between dietary fat, maybe even animal fat, which increases the risk, and a more vegetable-based diet, more fiber in the diet will reduce the risk of colon cancer. And then finally, 30 minutes of exercise never hurts anybody. So aerobic exercise has been shown to reduce your fat in your body and reduce your risk of colon cancer.
And doctor, let me ask you, I know catching it early is key. So let's talk about screenings, and have there been advancements in screenings?
Yeah, so screening has come through a long way. So when I first started in medicine about 25 years ago, the standard of care would be to do three things. One would be to do a sigmoidoscopy, which is just looking at the last third of the colon. Number two would be to do a stool blood test to see if there is any occult blood in the stool. And number three, maybe to do a barium enema to see if we can see anything, and we would stop at that point. The problem is at least a third to 40% of the colon cancers are on the right side of the colon, not on the left side, so it would miss significant amounts. And then came major advances in fiber optic colonoscopy. This became a lot easier. So colonoscopy became the standard of care, and we were recommending it for people beyond 50 at that point. And then we have had more significant advances. There are two or three major advances. One is something called CT colonoscopy, which is to do a CT angiography looking at the colon through a CAT scan machine. That has been proven to be effective. The second big advance is looking at tumor DNA in the blood, in the stool. So those stool testing for tumor DNA has been definitely a big advance in people who do not want to go through a colonoscopy. We've been able to screen using the stool testing and see if you have any tumor-related DNA we're picking up. So those are the major advances we have.
That is amazing. That is great news to hear that there are so many advancements. So Dr. Nguyen, let me ask you, when someone is diagnosed with colon cancer, how are you treating them with chemotherapy and radiation?
Well, with colon cancer, where radiation comes into play is when we treat rectal cancer, which is the last part of the colon. We obviously need to work this up to see how far advanced the cancer is, a colonoscopy, a PET scan. If all goes well and the cancer is still confined to the rectum, let's say, then a combination of chemotherapy and radiation treatment can be given before definitive surgery takes place. Typically, the radiation treatment is given once a day, Monday through Friday. Take about 15 minutes or so, and the entire process, assuming there's no interruption, could last about 6 weeks or so. Common side effects: people feel a bit fatigued, they may feel a bit nauseous, there's more loose stool during treatment, and these things sound bothersome, but they are limited in that after the treatment is done, it typically goes away within a month or so. And then surgery would take place somewhere between 6 to 10 weeks after the bout of chemotherapy and radiation is done.
All right, doctors, thank you so much for joining us and bringing us this important information. We really appreciate your time. And if you'd like to learn more information about Ironwood, all you have to do is log on to their website, ironwoodcrc.com, or you can call any of their 10 locations. We'll be right back.